Hi, I'm Kiana, and this is a video on anti-Parkinsonism drugs. So before we start, it's important to know that Parkinson's symptoms are always due to low dopamine. So treatment strategies usually are centered around raising the dopamine in the patient's brain. Usually their acetylcholine is too high and the dopamine is low because of this. So patients are losing dopaminergic neurons in the substantia nigra, which is a part of the brain. And because of this, acetylcholine can't be inhibited and it builds up. So patients with Parkinsonism will present these symptoms. Get the R capitalized 2 there. Rigidity, ataxia, a flat expression, and tremor. They'll also sometimes have like a pill rolling motion in their hands, and their gait is more of like a shuffling type of gait. So before we go into the drugs, let's go through this image a little bit. This image is from your notes, the PowerPoint notes. It's a great image. I would highly recommend copying it. It's great. So this purple is outside the blood-brain barrier. And I want to point out that Ldopa is actually a dopamine analog. And that's the drug that's most commonly used in Parkinson's because it increases dopamine. It's basically literally dopamine, Ldopa. This enzyme, dopa decarboxylase, is what breaks down dopamine and will decrease the amount of dopamine in a normal person. When we use this drug, carbidopa, we're going to inhibit the enzyme dopamine decarboxylase. And when we do that, we'll have more dopamine to go into the brain because dopamine usually has a hard time crossing the blood-brain barrier, but the more that we have, the more can get across the blood-brain barrier in these patients. And those concepts are really important to know for these drugs. All right, let's get to it. So levodopa, and that is your Ldopa. It creates more Ldopa for the brain, and usually dopamine has a low bioavailability, so not much can cross the brain. By putting more dopamine there, hopefully we're going to get more into the brain of these Parkinson's patients. So if you use this drug in combination with MAO or COMT inhibitors, less drugs should be used. And remember, these are responsible for the breakdown of norepinephrine and kind of like recycling neurotransmitters. So you're not going to break down the dopamine as well if you're inhibiting kind of like the recycling system for all those neurotransmitters. You have to use less drug if you're inhibiting what breaks them down. Carbidopa. So this is what inhibits the decarboxylase enzyme. I believe it's decarboxylase. Yes, it is decarboxylase. And this allows dopamine to not be broken down. So more dopamine is staying whole and can go to the brain. So when we use levodopa plus carbidopa, the levodopa won't get broken down and more can go into the brain for the patient. And that's what we're trying to do. So in combination with levodopa, lower doses of both drugs can be used because that dopamine is staying whole. It's not being broken down from the levodopa. The carbidopa is kind of protecting it from the enzyme dopa decarboxylase. Primoprexal is a dopamine agonist, and it can be used alongside levodopa if the Parkinsonism is really severe. Bromocriptine, you don't really see it used as much in Parkinsonism, but it's a dopamine 2 agonist. It can also cause inflammation in the extremities, and that's from being an ergot alkaloid. And I think you'll learn that a little bit later, or you may have already learned that. But just know it can cause swelling in the arms and legs. Bromocriptine. Amantadine. So it's a weak antagonist, so it's blocking the glutamate receptor. And again, this is hardly used in Parkinson's disease. The two drugs you should really know for Parkinson's, levodopa and carbidopa. Focus on those. And ethosuximide shouldn't really be here. We talked about it in the last video. Okay, so here's a review question for you. What drug can increase the dopamine level in the brain without actually altering dopamine amount? So this is kind of a tricky question. The answer I'm looking for here is going to be carbidopa. And again, if we look at this image, if we inhibit dopa decarboxylase, we're going to have more dopamine. And that's what this drug is doing. More dopamine is available. Not getting broken down. What drug is an analog of dopamine? And the answer we're looking for here is levodopa, also called Ldopa. And what two neurotransmitters are out of balance in Parkinson's patients? The answer here is going to be acetylcholine, which is high, and that causes dopamine to be low. Remember, dopaminergic neurons are lost, and dopamine is low because of that. And last question here, what part of the brain is affected in Parkinson's? The substantia nigra. Good to know. You'll see that a few times in either pathology or even pharmacology, you might see it. And one other good thing to know, what kind of histology is seen in the brain of Parkinson's patients? It's a type of body that I'm looking for. It's a name. Bodies you'll see in the brain of Parkinson's patients. All right, if you guys have any questions on Parkinson's or anti-seizure drugs, feel free to send me an email or reach out for help.